Welcome to the deep dive. You know, our pets are family, and keeping them healthy is always top of mind.
hmm
Today, we're diving deep into something that affects, well, quite a few of our furry friends, heart conditions.
Right, a really important topic.
We're going to explore common issues in both dogs and cats, uh, try to understand what they mean, and even look at how their diet plays a crucial role in keeping those hearts ticking strong.
Absolutely. And for this exploration, we've gathered some really informative material. We'll be looking at the latest guidelines on a very common canine heart problem called myxomatous mitral valve disease,
Okay.
insights into dilated cardiomyopathy in dogs, and there's a study that tracked congenital heart issues in dogs over 2 decades.
Wow, 20 years.
Yeah, quite a span.
Huh?
We also have essential information on heartworm disease in cats, some handy resources for pet owners from the veterinary manual, and a breakdown of the nutritional needs of our small animal companions.
Our goal today is really to cut through some of the technical stuff and pull out the most important things you need to know from all this great information.
Exactly.
We want you to feel well-informed and, empowered to care for your pets. So let's jump right in with what seems to be the most frequent heart problem in dogs. Myxomatous mitral valve disease, or MMVD.
That's right. The experts actually say that MMVD accounts for about 3 out of every 4 cases of heart disease in dogs in North America. Huge number.
75%, that's massive.
It is. You might also hear vets call it endocardiosis or chronic valvular heart disease.
Okay.
What's really interesting is that the way vets approach this disease has changed quite a bit over the years. There were updated guidelines in 2019 that have, well, shifted how we think about managing it even before a dog shows any outward signs.
So it's not just waiting for symptoms, to appear. There's a way to understand how it develops over time.
Exactly. The guidelines break it down into 4 main stages, which helps vets determine the best course of action.
Excellent.
So stage A is for breeds known to be at higher risk, like Cavalier King Charles Spaniels are a classic example.
Right.
But these dogs don't have any structural heart problems yet. For these guys, a yearly check of their heart with a stethoscope, just a good listen, is recommended.
Kind of like keeping an extra close eye on breeds that are more likely to have this issue. What happens in stage B? That's when things start to change physically with the heart, right?
Yes. In stage B, there's structural heart disease present, meaning a vet can actually hear a heart murmur.
Okay.
But the key thing here is that the dog isn't showing any signs of heart failure yet. No symptoms.
Got it.
And this stage is further divided into B1 and B2. Dogs in stage B1 don't have changes severe enough yet to warrant medication aimed at delaying heart failure.
So monitor, but no treatment necessarily.
Right. However, in stage B2, the changes in the heart are more significant, and there's good evidence now, strong evidence really, that starting treatment at this point can actually push back the onset of heart failure.
Okay, now here's where it gets really interesting for a listener with maybe a dog prone to MMVD. What exactly are these more significant changes in stage B2 that would trigger treatment?
That's a great question. Vets primarily look at measurements taken during an echocardiogram, that's an ultrasound of the heart.
Right, the echo.
One key measurement is the ratio of the size of the left atrium, that's one of the heart's chambers, to the size of the aorta, the main artery leaving the heart. If this LAAO ratio is 1.6 or higher, that's a sign.
1.6.
Another important measurement is the size of the left ventricle when the heart is relaxed, called the left ventricular internal dimension in diastole, or LVIDD. This measurement is adjusted based on the dog's body weight, normalized.
Ah, makes sense for different sized dogs.
Exactly. If this adjusted LVIDD is 1.7 or greater, that also suggests stage B2.
So for a listener with, say, a Cavalier King Charles Spaniel, it sounds like regular cardiac checkups might involve not just listening, but potentially more advanced imaging like an echo as they get older to catch these subtle changes early.
Absolutely. Early detection is key here. And even if an echocardiogram isn't readily available, maybe in certain practice settings, there's another measurement called the vertebral left atrial size, or VLA.
VLAS.
Yeah, VLAS. It can be taken from standard x-rays, which are more widely available. If the VLAS is 3 or greater, that can also indicate the likelihood of being in stage B2.
Okay, so stage B is all about catching it early using these more detailed diagnostics. What happens when the disease progresses and we move into stage C?
Stage C is when a dog has current or has had past clinical signs of heart failure directly caused by MMVD. actual symptoms.
Right, symptoms we can see.
These signs could be things like noticeably rapid breathing, which we call tachypnea,
Tachypnea, okay.
restlessness, actual difficulty breathing or respiratory distress, and maybe a persistent cough.
Okay.
At this point, vets will want to get a comprehensive picture. That usually means chest x-rays, ideally an echocardiogram to really see what's going on in the heart structure and function, and some basic blood and urine tests to check overall organ function, especially the kidneys, because that can really impact treatment choices.
And stage D, that sounds like the most advanced and, well, challenging stage.
Yes, stage D is when the heart failure is severe and it just doesn't respond well to the usual conventional treatments.
Refractory, they call it sometimes.
Exactly, refractory heart failure. These dogs require more intensive or even experimental approaches, and sometimes, unfortunately, the focus shifts to keeping them comfortable through palliative care.
Let's just circle back to diagnosing stage B for a moment. You mentioned listening for a murmur and then potentially doing an echo. What's the typical process there for vets?
Usually the first clue is hearing that specific type of heart murmur, the mitral regurgitation murmur, during a routine checkup.
Just listening with a stethoscope.
Right. If that's the case, the next step is often chest x-rays to see if there are any signs of the heart being enlarged or if there's any fluid buildup in the lungs. Measuring blood pressure is also important. However, an echocardiogram is really the gold standard, the best way to confirm that MMVD is the cause of the murmur, to see exactly how enlarged the heart chambers are, and to check for other related problems like pulmonary hypertension, which is increased pressure in the lungs.
Makes sense.
And as we mentioned, if an echo isn't an option for some reason, that VLAS measurement on x-rays can give a pretty good indication of the size of the left atrium.
Okay. Now, for dogs who have reached stage C or D, where heart failure is present, what are the main goals when it comes to long-term management, especially if, say, surgery isn't an option?
Well, the main goals are really multifaceted. You want to help the heart pump more effectively, hemodynamically.
Got it.
Try and slow down the progression of the disease itself to help the dog live longer and, importantly, more comfortably.
Quality of life.
Exactly. Reduce those obvious signs of heart failure like coughing and breathing difficulties. Improve their energy levels so they can maybe exercise a bit more, help them maintain a healthy body weight, and overall just give them the best possible quality of life.
Yeah. Stage C can sometimes involve these acute episodes where the heart failure suddenly gets much worse. What does the immediate treatment look like in those critical situations?
Yeah, those are emergencies. In those moments, getting oxygen to the dog is often the absolute top priority.
Oxygen first.
Right. If there's significant fluid buildup in the chest or abdomen making it hard to breathe, vets might need to drain that fluid.
Yeah.
Procedures called thoracocentesis or abdominocentesis.
Okay. Draining the fluid.
And because these episodes can be very stressful for the dog, sedation with medications like butorphanol can really help calm them down.
Reduce anxiety.
Diuretics like furosemide, often called Lasix, are essential for getting rid of that excess fluid. Medications that help widen blood vessels, vasodilators like sodium nitroprusside for really severe fluid in the lungs, or maybe hydralazine and amlodipine for general support, can also be used.
Okay.
ACE inhibitors like enalapril or benazepril are often part of the long-term plan, although their immediate effect in a crisis might be, well, less dramatic, but they are important.
Right.
If the dog is already taking pimobendan, a medication that helps the heart muscle contract more strongly and also dilates vessels,
Abendin.
that will likely be continued. Spironolactone can be added as an extra layer of support for chronic management. It works against a hormone called aldosterone.
Okay.
It's important to note, though, that beta blockers are generally avoided during active heart failure. And in some cases where there's a very fast, irregular heartbeat called atrial fibrillation, a drug called digoxin might be used to help slow the heart rate down.
And when stage C heart failure becomes resistant to standard treatment, so it's not getting better, what are the next steps? That sounds like what leads into stage D, right?
Exactly. When that happens, when it becomes refractory, more aggressive ways to reduce the workload on the heart are often needed. But this requires very close monitoring of blood pressure. You don't want it to drop too low.
Tricky balance.
Very. In really severe cases, intravenous medications like nitroprusside or dobutamine might be given through a constant infusion, a CRI.
In the hospital setting.
Yes, definitely an in-hospital thing. Oral medications like hydralazine or amlodipine might be added or have their doses increased, again with careful checks on blood pressure and, importantly, kidney function within 24-72 hours.
Got to watch those kidneys.
Always. If there's also high blood pressure in the lungs, that pulmonary hypertension we mentioned, a medication called sildenafil might be used.
Sildenafil.
And in some situations, medications to open up the airways called bronchodilators might also be considered if there's a respiratory component.
What about the long-term, day-to-day management for dogs in stage D who are living with this advanced heart failure at home?
Yeah, for these dogs, the dose of their diuretic medication, like furosemide or maybe sometimes switching to torsemide, often needs to be adjusted based on how they're doing clinically, and their kidney function needs to be watched very closely. Frequent blood tests. They might continue on those medications to reduce the workload on their heart, the afterload reducers like amlodipine or hydralazine. And digoxin might be used for atrial fibrillation or possibly as part of the overall management for all stage D patients, depending on the vet's judgment and the specific case.
Okay, that's a really thorough, excellent look at MMVD in dogs. Let's switch gears now, if we can, and talk about another significant heart condition. Dilated cardiomyopathy, or DCM.
Right, DCM. Dilated cardiomyopathy is primarily a disease of the heart muscle itself, the myocardium.
The muscle itself, not the valves, like MMVD.
Exactly. The muscle becomes stretched, thin, and weakened, making it much harder for the heart to pump blood effectively around the body.
What causes it?
Often we actually don't know the exact cause. It's termed idiopathic, but in many cases there seems to be a genetic or inherited component, especially in certain breeds.
What are some of the signs that might make an owner or, a vet suspect DCM in a dog?
Owners might notice things like their dog coughing, having difficulty breathing or breathing rapidly, maybe fainting spells or collapsing episodes.
Syncope, right.
Syncope, exactly. And sometimes they might see the belly becoming swollen with fluid, which is a condition called ascites.
And what might a veterinarian find during a physical exam? What clues might they pick up?
A vet might hear a soft heart murmur, often due to the mitral valve leaking because the heart's enlarged.
Secondary to the muscle problem.
Precisely. They might also hear a specific type of extra heart sound called a gallop rhythm, specifically an S3 sound, and they might detect an irregular or rapid heartbeat, an arrhythmia.
Okay.
In certain large breeds that are more prone to DCM, like Doberman Pinschers, for instance, the sudden appearance of a new heart murmur or a gallop rhythm or an irregular heartbeat is definitely a red flag. It warrants a more in-depth cardiac workup because primary valve disease, like MMVD, is actually less common in these specific breeds.
Interesting distinction.
Yeah. And while DCM mainly affects the left side of the heart initially, it can eventually involve both sides, leading to signs of right-sided heart failure as well, like swelling in the legs or that fluid in the abdomen, the ascites. This biventricular involvement is perhaps more often seen in giant breeds.
Are there particular breeds that are really susceptible to DCM? And is there any value in screening seemingly healthy dogs of those breeds?
Absolutely. Breeds like Doberman Pinschers, Boxers, Great Danes, and Irish Wolfhounds are known to be at higher risk.
The bigger guys often.
Often the larger and giant breeds, yes. Because DCM often develops in adulthood and the age it starts can vary quite a bit, annual screening is often recommended for these breeds.
What does screening involve?
It typically involves an echocardiogram to look at the heart's structure and function, how well it's pumping, how big the chambers are, and a Holter monitor.
The 24-hour ECG.
Exactly. It's a small device that records the heart's electrical activity over a 24-hour period to catch any intermittent arrhythmias that might not show up on a quick ECG in the clinic.
Makes sense.
It's important to keep in mind, though, that sometimes changes seen on these tests could be due to other health issues, maybe systemic diseases. So if something questionable pops up, it might need to be rechecked in, say, 6 to 12 months.
What's the outlook generally for dogs diagnosed with DCM, especially once they start showing symptoms? I've heard it can be quite serious, particularly in Dobermans.
Unfortunately, yes. Once a Doberman Pinscher with DCM starts showing clinical signs of heart failure, the prognosis is often quite poor. Many succumb to heart failure or sudden cardiac death within about 6 months. It's very rapid sometimes.
That's tough.
It is. At this point, treatment is mainly focused on managing the symptoms and trying to improve their quality of life, making them comfortable. It becomes palliative.
Is there anything that can be done earlier?
Well, there's some evidence suggesting that starting an ACE inhibitor, like enalapril, when the heart muscle is already enlarged, but before full-blown heart failure develops the occult stage, they call it, might help slow down the disease's progression.
So potentially delaying the onset of symptoms.
Potentially. And as we'll discuss, a medication called pimobendin has made a really significant difference in improving survival times once heart failure develops, although Importantly, it's not a cure. The role of beta blockers in these early occult stages of DCM is still being actively researched and debated.
When a dog with DCM does develop congestive heart failure, what's the primary focus of treatment then?
The main goal is to support the heart's pumping ability, its contractility, and chemobendin is a key medication here.
Why pimobentin?
It has a dual action. It not only helps the heart muscle contract more strongly, making each beat more effective, but it also helps to widen blood vessels, which reduces the resistance the heart has to pump against, makes its job easier.
Okay, helps in two ways.
Right. And studies, particularly in Dobermans with DCM, have shown it can significantly extend survival times compared to older treatment regimens.
That's encouraging.
It is a big step forward. Of course, other standard heart failure medications are also crucial. ACE inhibitors like enalapril are still used, and diuretics like furosemide are needed to reduce fluid overload, that congestion.
Right, the standard CHF toolkit.
Pretty much. In addition, some vets might recommend dietary supplements containing things like taurine, L-carnitine, and omega-3 fatty acids as supportive measures, although the evidence for their benefit can vary.
DCM can sometimes lead to those irregular heartbeats, especially from the ventricles, right? How are those managed?
Yes, ventricular arrhythmias are a common and dangerous complication of DCM. Managing them is an area where there's, well, not always a clear-cut consensus on exactly when or how to treat.
Why is that?
Because the drugs themselves can sometimes have side effects, and it's not always certain that suppressing the arrhythmia improves long-term outcome. However, if a dog with DCM has very fast ventricular arrhythmias, what we call ventricular tachycardia, VTAC, yes, or complex patterns of irregular heartbeats, or if these arrhythmias are occurring alongside significant heart enlargement and really weakened pumping function, then treatment to reduce these arrhythmias might be considered.
What medications are used?
Medications like sotalol or mexiletine can be used. It's worth noting that sotalol needs to be used cautiously if the heart's pumping ability, the systolic function, is already significantly reduced.
Potential side effects.
Right. Metalotine is often better tolerated if given with food to help prevent nausea, which can be a side effect.
What are the goals of using these drugs?
The goals are generally to reduce the frequency of these abnormal heartbeats, alleviate any symptoms they might be causing, like weakness or fainting, and hopefully lower the risk of sudden death, which is a real concern with DCM. But again, the overall effectiveness of these anti-rhythm drugs in actually achieving all these goals, especially improving survival, hasn't been definitively proven in large studies.
So a complex decision for the vet and owner.
Very much so. Needs careful consideration of risks and benefits.
Okay, let's move on now to a different category of heart issues. Congenital heart diseases in dogs. These are problems that puppies are born with, correct?
Yes, exactly. Congenital means present at birth. These are structural abnormalities of the heart or the major blood vessels connected to it. There was a really interesting study we looked at that tracked how common these diseases were, which breeds were most affected, and how things changed over a 20-year period at a large veterinary referral center.
20 years of data, that's substantial. What were some of the most frequently seen congenital heart defects in that particular study?
The study found that the most common ones were pulmonic stenosis, often just called PS,
PS, yeah.
patent ductus arteriosus, or PDA,
PDA.
and subaortic stenosis, usually shortened to SAS.
PS, PDA, SAS, got it.
Less frequently, they saw things like ventricular septal defect, VSD, which is a hole between the lower chambers of the heart, and tricuspid dysplasia, TD, a malformation of one of the heart valves.
Were there any particular dog breeds that showed up more often with these kinds of heart problems in that study group?
Yes, the breeds that were most commonly represented with congenital heart defects were boxers, German shepherds, French bulldogs, and English bulldogs.
Some popular breeds in there.
Definitely. And interestingly, some breeds like Chihuahuas, American Staffordshire Terriers, Border Collies, French Bulldogs again, and Cavalier King Charles Spaniels showed a lot of what the study called volatility.
Volatility, meaning
Their popularity as breeds changed significantly over those 2 decades the study covered. Went up and down quite a bit.
That's fascinating how breed popularity itself can shift so much. Did the study find any link between how popular a breed was and how often they saw certain heart defects in that breed?
They did indeed find a positive correlation overall. It seemed as the popularity of certain breeds increased, so did the number of those dogs presenting to the referral center with congenital heart diseases.
Why might that be?
Well, it might be due to a number of factors. Increased demand could lead to more breeding. perhaps sometimes with less emphasis on careful genetic screening for known health issues.
Right, meeting demand quickly.
Possibly. The study also highlighted something positive, though. A screening program, specifically for pulmonic stenosis in boxers, seemed to be effective in reducing how often that specific defect was seen in the breed over time.
So screening can work.
It suggests it can, yes. However, they also noted that, broadly speaking, what makes a dog breed popular seems to be driven more by trends, fashion, and appearance, rather than by known health concerns within that breed.
It's a bit sobering.
It is appearance over health sometimes, unfortunately.
Let's zoom in on some of these specific congenital heart defects. You mentioned pulmonic stenosis. PS was the most common.
That's correct. Pulmonic stenosis was the most frequently diagnosed congenital heart problem in their population. It sometimes occurred on its own as an isolated defect, but could also be found alongside other defects like SAS, VSD, and PDA.
Any breeds particularly prone?
Breeds with flatter faces, the brachycephalic breeds like English and French bulldogs had the highest rates of pulmonic stenosis. And interestingly, the prevalence in those breeds actually increased during the study period, even as it decreased in boxers, likely due to that screening program we mentioned.
Wow.
The most common type of PS they observed was called type A. They also noted a specific unusual type of PS related to an abnormal coronary artery called PSR2-ACA, which was most often seen in English and French bulldogs, but also Brussels Griffons, American Staffordshire Terriers, and Corso dogs.
Okay. And what about patent ductus arteriosus, or PDA? That was second most common.
PDA was the second most common overall. It was frequently found in both larger breeds like Dobermans, German Shepherds, and Newfoundlands, and also in smaller to medium-sized breeds like Maltese, Poodles, Cavalier King Charles Spaniels, Border Collies, and Chihuahuas, so quite a range of sizes.
Any other patterns with PDA?
They saw PDA more often in female dogs, which is a known association, and it was most frequent in the years between 2006 and 2011 in their data. Interestingly, they didn't see any cases of PDA in boxers, American Staffordshire Terriers, or Dogue de Bordeaux breeds that tended to have higher rates of PS or SAS instead.
Huh.
A less common form called reverse PDA, or RPDA, was mostly found in Maltese dogs in their study. The researchers suggested that the increased availability and use of a minimally invasive device called the Amplatzer canine duct occluder, which is used to close PDAs without open chest surgery.
Right, the little plug device.
Exactly. They thought the availability of that might explain some of the changes they saw in the frequency of PDA diagnoses during the study period. Maybe more were being diagnosed and referred for closure.
Makes sense. Subaortic stenosis, SAS, was also quite common, you said, at least in the earlier part of the study?
Yes, subaortic stenosis was actually the second most common congenital heart defect from 1997 up to 2011 in their cohort, after which its occurrence seemed to decrease a bit.
Any breed association?
It was often found together with pulmonic stenosis in boxers, and again, the screening program in boxers likely played a role in its reduction in that specific breed over time. SS was also notably common in the Dogue de Bordeaux breed.
Okay.
Interestingly, dogs diagnosed with aortic stenosis, which is a slightly different narrowing related to the aorta itself, were generally older when they were diagnosed compared to dogs with other congenital heart defects. And AS was more frequently seen in male dogs, with bull terriers being the most commonly affected breed in their study group.
And one more, tetralogy of Fallot.
Ah, yes. Tetralogy of Fallot, or TOF. That's a more complex defect involving 4 specific abnormalities. It was typically diagnosed in younger puppies, and in their study, always occurred as the only heart defect present, not in combination with others.
It sounds like a really intricate picture involving genetics, breed popularity trends, and even the availability of specific medical interventions changing the landscape over time.
Absolutely, a lot of interacting factors.
Let's now turn our attention to our feline companions and a specific heart-related concern in cats, heartworm disease.
Right, heartworm in cats. It's caused by the same parasite that affects dogs, Filaria immitis, and it's also spread through mosquito bites. So the cause and transmission are the same.
But it's different in cats.
Yes, it's really important to understand that cats aren't the natural or preferred host for heartworms, unlike dogs. So the disease often presents quite differently, and the cat's body reacts differently to the worms.
How so? What are the different stages or phases of heartworm disease in cats that owners should maybe be aware of?
Well, the American Heartworm Society describes 2 main phases where problems typically arise. The first phase happens when immature heartworms, the L5 larvae, arrive in the small arteries in the lungs.
Okay.
Many of these young worms actually die off in cats because cats are resistant hosts, but this dying off process triggers a very strong inflammatory response in the lungs and airways.
Inflammation is the key.
Yes, this is often referred to as HARD, which stands for heartworm-associated respiratory disease. And it can sometimes be mistaken for other common feline breathing problems, like asthma or allergic bronchitis.
Hard. Okay. What's the second phase?
The second phase involves what happens if some worms do manage to survive to adulthood. The inflammation actually tends to lessen somewhat because the adult worms can suppress the cat's immune system a bit. However, problems often arise again when these adult worms eventually die, which can cause a sudden, severe inflammatory reaction, sometimes leading to shock or even sudden death.
So the worms dying can be dangerous too.
Very much so, both the immature ones and the adults later on.
What kind of symptoms might a cat with heartworm disease exhibit? You mentioned it can look like asthma.
The symptoms can be quite varied, and honestly, some cats might not show any obvious signs at all. They can be asymptomatic carriers. Very often, problems become noticeable when those adult heartworms suddenly die, causing a more acute reaction. Or sometimes if worms migrate to unusual locations in the body and cause damage elsewhere. But when cats do show symptoms, these can include being unusually tired or lethargic, coughing, loss of appetite, weight loss, maybe not being able to exercise or play as much, vomiting unrelated to eating, difficulty breathing or rapid breathing, sometimes even breathing with their mouth open, which is always a concern in cats.
Definitely.
In some cases, you might see neurological signs like wobbliness or seizures. If a worm migrates to the brain, a vet might hear a heart murmur, and sadly, as I mentioned, sudden death can occur with no prior warning signs.
We know there's treatment for heartworm in dogs, involving injections to kill worms. But I've heard it's much more complicated, even dangerous in cats.
That's absolutely correct. It's a critical point. Many of the drugs used to kill adult heartworms in dogs, specifically the injectable drug melarsamine, brand name imidacide, are actually toxic to cats and are strongly not recommended. In fact, the American Heartworm Society, which is really the leading authority on this, doesn't currently advise using any medications to try and kill adult heartworms in cats.
Not at all. Why not?
Because the risk of serious, even fatal complications from the dying adult worms breaking apart and causing blockages or severe inflammation in the lungs is just considered too high in cats. It's too dangerous.
So if vets can't directly kill the adult worms in cats, what does treatment focus on then? How do you manage it?
Treatment in cats is primarily aimed at managing the symptoms and reducing that inflammation in the lungs and airways caused by the worms, both living and dying.
Managing the inflammation.
Exactly. Corticosteroids, like prednisolone, are often prescribed to help decrease this inflammation, especially in cats that are coughing or have abnormal findings, inflammatory patterns on their chest x-rays.
Steroids, okay.
An antibiotic called doxycycline is sometimes used as well. It doesn't kill the heartworms directly, but it targets a type of bacteria called Wolbachia that lives inside the heartworms. Killing these bacteria seems to reduce the inflammation associated with the worms.
Interesting. Targeting bacteria within the worm.
Yeah, it's an indirect approach. Other medications that help open up the airways, bronchodilators like terbutaline, theophylline, or albuterol inhalers might also be used if the cat is having significant trouble breathing.
So it's all about symptom management.
Primarily, yes. Symptomatic and supportive care.
Is there, therefore, a cure for feline heartworm disease? And what's the long-term outlook for an affected cat?
Well, without medication to kill the worms or surgery to physically remove them, which is very rarely feasible or attempted,
Right.
there isn't a direct cure in the way we think of it for dogs. The goal of management is basically to keep the cat as comfortable and symptom-free as possible for as long as possible, essentially hoping that the cat will naturally outlive the heartworms.
How long do the worms live in cats?
Typically, they have a shorter lifespan in cats than in dogs, usually just a few years, maybe 2 to 4 years on average. So the average survival time for cats diagnosed with heartworm disease is often quoted as somewhere between 1.5 to 4 years after diagnosis.
So you manage them through that worm lifespan.
That's the hope. Successful management requires very close monitoring by a veterinarian and a good understanding by the owner of the potential risks and the need for ongoing care, possibly for years.
Given how challenging and risky treatment, or rather management, can be, prevention seems absolutely essential for cats. What are the options there?
Absolutely. Prevention is, without a doubt, the best approach for cats. It's safe, it's effective, and it avoids all the complications we just discussed.
What's available?
Fortunately, there are several very effective heartworm preventative medications available for cats. Many are topical liquids applied to the skin monthly, some are oral. And a bonus is that many of these products also offer protection against other common parasites like intestinal worms, fleas, and ticks, all in one application.
Multitaskers.
Yeah, very convenient. It's recommended to start kittens on these preventatives relatively young, around 8 weeks of age, and crucially, continue them year-round for their entire lives.
Even for indoor cats.
Yes, absolutely. Even for indoor-only cats. There's a common misconception that indoor cats are safe, but mosquitoes can easily get indoors through open doors, windows, screens with holes.
Yeah.
And it only takes one bite from an infected mosquito to transmit the parasite. So year-round prevention for all cats is the recommendation.
And just to clarify, cats can't give it to other cats, right?
Correct. Heartworm cannot spread directly from one cat to another, or from a dog to a cat, or vice versa. A mosquito is always required as the intermediate host to transmit the infective larvae.
Good to know. Okay, finally, let's dive into the really vital role that nutrition plays in the overall health of our small animal companions, dogs and cats.
Yes, nutrition. It's truly the foundation of good health for both species, and it definitely plays a critical role in supporting a healthy cardiovascular system as well, alongside everything else.
Where do we start? Dogs and cats have different needs, right?
Yes, that's a crucial point to remember right off the bat. Cats have quite different, in some ways more specific, nutritional needs compared to dogs. For example, cats are obligate carnivores.
Dang.
Meaning they require certain nutrients found only in animal tissues. They need to get things like preformed vitamin A, an essential fatty acid called arachidonic acid, and the amino acid taurine directly from their diet. Dogs can often synthesize these or convert them from precursors.
So cats must eat meat-based components.
Essentially, yes, for those specific nutrients. Cats also generally have higher requirements for total protein, some specific amino acids, and certain B vitamins compared to dogs. You can't just feed a cat dog food long-term or vice versa.
There's so much information out there about different types of pet food, limited ingredient diets, grain-free raw food diets. Are there any specific nutritional things we should be particularly aware of for our pets' heart health and overall well-being from these sources?
Yes. It's crucial to understand that ensuring complete and balanced nutrition is paramount. Even commercially available dog and cat foods, and especially homemade diets that aren't carefully formulated by a board-certified veterinary nutritionist, can sometimes be lacking in essential nutrients or have imbalances.
Like what?
For instance, a diet that's primarily just meat, like muscle meat, without bone or supplementation, can lead to a severe deficiency in calcium and an imbalance with phosphorus. Very dangerous, especially for growing animals.
Okay.
The way food is prepared also matters. Raw versus cooked can impact nutrient availability. For example, raw egg whites contain a protein called avidin that binds to biotin, a B vitamin, making it unavailable.
I didn't know that.
Yeah. And some raw fish contain enzymes called thiominases that can destroy thiamine, another crucial B vitamin. Cooking usually inactivates these problematic substances, but excessive heat during processing can also reduce the levels of some other vitamins. It's a balance.
What about just the basics, like calories?
Getting the right amount of energy or calories is fundamental. We measure it as metabolizable energy, ME, usually in kilocalories or calories. It's essential for maintaining a healthy body weight, a good body condition score, BCS, and muscle condition score, MCS, throughout all life stages.
BCS and MCS, the vet scores those right.
Yes, they're hands-on assessments of fat cover and muscle mass. If your pet seems to need significantly less food than what's recommended on the bag or can label to maintain weight, it's worth investigating. It could be a sign of an underlying health issue like hypothyroidism in dogs or just a naturally lower metabolism.
Good point.
There are also specifically formulated weight management diets that are less energy dense, lower in calories, but still provide all the necessary nutrients in the right proportions for that smaller volume of food. Severely restricting calories of a regular diet without proper guidance can easily lead to nutrient deficiencies.
And those prescription weight loss diets.
Right. Therapeutic weight loss diets are very low in calories, but are carefully formulated to be nutritionally complete and balanced, ensuring safe weight loss under veterinary supervision.
Okay. What about the main building blocks, protein, fats, and carbohydrates? How do those factor into overall health and maybe heart health?
Well, protein provides amino acids, the building blocks for tissues, enzymes, hormones, everything. Dogs need 10 essential amino acids in their diet, while cats need 11, with taurine being that extra one crucial for cats, especially for heart health and vision.
Taurine, yeah, we hear about that for cat heart.
Absolutely critical. The quality of the propane, specifically how easily it's digested and absorbed, also matters. Needs vary by age, activity, health status.
And fats.
Fats and fatty acids are a concentrated source of energy and essential for many functions. Linoleic acid, an omega-6 fatty acid, is essential for both dogs and cats. Cats have that additional need for arachidonic acid, another omega-6.
Omega-6s. What about omega-3s?
Omega-3 fatty acids like ALA, EPA, and DHA are also important, particularly for things like brain development, vision, reducing inflammation, and supporting skin health. Good sources include oily fish, krill oil, and algae oil for EPA and DHA.
Okay. And carbs. Do pets need carbs?
Carbohydrates provide a readily available source of glucose for energy, which is definitely needed by certain tissues like the brain. However, they aren't considered strictly essential in the diet for adult, non-reproducing dogs and cats.
Why not?
Because their bodies, particularly their livers, are very good at producing glucose from other sources, like amino acids and fats, through a process called gluconeogenesis. But carbs in commercial diets provide energy, texture, and can be a source of fiber.
Ah, fiber. We hear a lot about fiber benefits in human diets. Does it play a similar role in our pets' health?
Yes, fiber, which essentially comes from the parts of plants that resist digestion in the small intestine, definitely has several beneficial effects in pets, even though there isn't a strict dietary requirement for it.
Like what kind of benefits?
It can help regulate bowel movements, it can absorb toxins in the gut, influence how bile acids are processed, and certain types can affect how quickly glucose is absorbed after a meal. It can be helpful in diabetic pets.
Okay.
However, too much fiber, or the wrong type, can actually interfere with the absorption of other important nutrients, so balance is key.
Are there different types of fiber?
Yes, broadly speaking, it's divided into insoluble fiber, which doesn't dissolve in water and helps add bulk to the stool, promoting regularity.
Like cellulose.
Like cellulose, yes.
Yeah.
And soluble fiber, which does dissolve or absorb water. Soluble fiber can be further categorized based on whether it forms a gel, viscous or not, non-viscous, which affects things like how quickly the stomach empties.
Interesting.
Another important characteristic is fermentability, how easily it's broken down by bacteria in the large intestine. This fermentation produces short-chain fatty acids, SCFAs. Yes, like acetate, propionate, and butyrate. These are actually beneficial. They provide energy for the cells lining the colon, help with water and sodium absorption, and lower the pH in the colon, which can inhibit some bad bacteria. Moderately fermentable fibers are often preferred. Fiber also acts as a prebiotic, feeding the good gut bacteria.
Vitamins are also clearly vital. Are there any specific vitamin considerations that are particularly important for the health of dogs and cats, maybe relating back to heart or overall health?
Absolutely. Vitamins are essential organic compounds. We talked about vitamin A earlier. Dogs can convert beta-carotene from plants, but cats need preformed vitamin A from animal sources. Both deficiencies and excesses can cause problems.
Right. What about others?
Vitamin C is an antioxidant, but dogs and cats can synthesize their own, so it's not typically required in the diet unless there are specific health issues, though supplementation needs caution with urinary stone history. The B vitamins are crucial cofactors in metabolism. Thiamine B1 deficiency can happen with diets high in raw fish containing thiaminases. Niacin B3 is needed in the diet for cats, while dogs can make some. Biotin deficiency is rare, but can occur with raw egg white consumption due to avidin. Folate is important, and low levels can indicate absorption problems, while high levels might suggest bacterial overgrowth in the gut.
And vitamin B12, cobalamin.
Yes, cobalamin B12 is really important, especially for rapidly dividing cells like in the gut and bone marrow. It's found mainly in animal products and absorbed in the last part of the small intestine, the ileum. Deficiency can cause anemia, neurological issues, and gut problems.
Can certain conditions cause B12 deficiency?
Yes, deficiencies are linked to various conditions affecting the pancreas or intestines in both dogs and cats, and certain breeds like giant schnauzers or border collies can have inherited absorption issues. Often, if there's malabsorption, B12 needs to be given by injection to bypass the gut.
Wow, nutrition is so complex but so fundamental.
It really is.
This has been such an incredibly informative deep dive into these heart conditions and the absolutely vital role of nutrition in our beloved pets. What would you say are the most important key takeaways for our listeners today, just to kind of summarize?
Well, I think first, remember that myxomatous mitral valve disease, MMVD, is really common in dogs, especially certain breeds. And early detection through regular checkups, listening carefully, and sometimes using more advanced diagnostics like echo or x-ray measurements is really key to managing it effectively and potentially delaying heart failure.
Okay, MMVD common, early detection vital.
Second, dilated cardiomyopathy, DCM, is a serious condition of the heart muscle itself, particularly in certain large and giant breeds. While treatment, especially with drugs like pimobendan, can help improve survival and quality of life, it's important to be aware of the often guarded prognosis, especially once symptoms appear.
DCM serious, predisposition, treatment helps, but often palliative.
Third, congenital heart diseases are present at birth and vary quite a bit in their occurrence among different dog breeds. And it seems, interestingly, that the popularity of a breed can sometimes influence how often these conditions are seen, highlighting the need for responsible breeding practices.
Congenital means from birth, breed links, popularity factor.
Fourth, switching to cats, heartworm disease is a significant concern. And because treatment to kill the worms is dangerous and not recommended in cats, prevention safe, effective year-round prevention for all cats, even indoors, is absolutely crucial.
Heartworm prevention, prevention, prevention.
Exactly. And finally, nutrition really forms the bedrock of overall health for both dogs and cats. Remember, cats have unique dietary needs, especially for things like taurine. Ensuring a complete and balanced diet, appropriate for their life stage and health status, is absolutely essential for supporting a healthy heart and a good quality of life overall. Avoid unproven or unbalanced diets.
Nutrition is foundational, cats have special needs, balance is key. Got it.
That's a good summary.
Thinking about all the factors we've discussed today, the genetics, the environment they live in, including their lifestyle and crucially their diet, and how all these things interact in the development and progression of these diseases.
Yeah.
What role do you think personalized approaches to veterinary care will play in the future, tailoring things more?
Oh, absolutely. I think that's definitely the direction things are heading. As we learn more about individual genetic predispositions, the effects of specific nutrients, and how different animals respond to treatments, it just makes sense that we'll see a greater emphasis on tailoring preventative strategies, screening protocols, and treatment plans to each individual animal based on their specific risk factors, their genetics, their environment, and their ongoing health status. Personalized pet medicine, essentially.
Personalized pet medicine. It's definitely something to think about as you, our listener, continue to learn and care for your own animals.
Yeah, it's an exciting future, hopefully leading to even better care.
We really encourage you to explore resources like the Merck Veterinary Manual if you want more in-depth information on any of these topics. It's a great resource. And of course, always consult with your own veterinarian. If you have any specific concerns about your pet's heart health or nutritional needs, they know your pet best.
Absolutely. Your vet is your primary partner in your pet's health.
Thanks so much for joining us for this deep dive.
Thank you.